Thank you so much for the welcome, and thank you to the organizers for putting this together and for giving some attention to these very important topics. Hopefully everybody can hear me and can see my screen. Um, my title of my talk is Exploring Exercise for Parkinson's Disease. And honestly, this is one of my favorite topics to talk about. Just to briefly tell you about my background, I actually grew up in a household where conventional Western medicine wasn't a common thing. I never saw my parents taking medications. We were always seeing specialists that didn't practice traditional Western medicine. And obviously, I took a different path and went to medical school and practiced traditional Western medicine. But I never lost sight of some of the philosophies that were just sort of natural to me growing up in that environment. And specifically, that was sort of this holistic approach to thinking about not treating specific symptoms, but treating diseases or people as a whole. And I noticed that in my day-to-day interactions with patients is that regardless of someone's background and what they think about traditional medicine, that everybody has this desire to be treated as a whole person, to not have just one specific symptom addressed, but to really improve quality of life as a whole day to day. And that's become a passion of mine as a focus. When I went into med school and I saw videos of people with Parkinson's disease before and after levodopa or before and after deep brain stimulation surgery, that really is what inspired me to go into movement disorders. The amazing effects of the medications that I use day to day keeps driving me to continue to get excited about the field. But within that, it's also important to realize that people need control. People need control over a disease that sometimes seems to change day to day, or even within a day can be unpredictable. And the sense of finding ways to empower you as the patient with Parkinson's to improve your day-to-day quality of life, I think that's where the importance of exercise really comes in. So just a few disclosures, none of these are relevant to my talk today. And my objectives for today's talk. So I'm gonna start by talking about just Parkinson's disease as not just a movement disorder, because exercise is gonna tap into treating the disease as a whole, treating all of the symptoms together. The role of exercise in Parkinson's disease, and specifically, where is there evidence behind exercise for Parkinson's disease? And then finally, I'll leave you with a summary of an exercise prescription that I talk to my patients about. So this is the Parkinson's puzzle. This is kind of a traditional famous puzzle that you'll see in a lot of slides and presentations about Parkinson's. When we think about Parkinson's as a motor disease, you think about this cartoon on the left of someone who appears stooped and a little bit slow. They have some tremor. They shuffle their feet when they walk. They're stiff. And these are the traditional motor symptoms that we call Parkinsonism. But within the puzzle of the full spectrum of the disease, Parkinsonism is one small piece, actually. And you can see all of these other non-motor things that can affect people with Parkinson's to different degrees in different people. And so this is really an individual disease, the saying that if you've met one person with Parkinson's, you've met one person with Parkinson's. That's because not only can the Parkinsonism vary from person to person, but the non-motor symptoms, the mood symptoms, the cognitive symptoms, these can all vary from person to person, and these need to be addressed as well. And so as we traditionally treat motor symptoms, we may use a medication that replenishes dopamine to improve physical symptoms like tremor and stiffness and slowness. And then we may be using a different medication to treat depression and another medication to deal with constipation. And you can see that we often end up having to deal with a lot of different symptoms individually. And so this idea of, can we find ways that in addition to treating with medication, that we can focus on the disease as a whole and improve both the motor and the non-motor aspects together. And that's where I think exercise has a particular advantage. So in the scheme of all the management options we have in Parkinson's, we would love there to be something that stops the disease or slows down the disease progression. What we deal with today are these options that you have here, is We have medications. We have medications that treat symptoms. And they're effective. We have, in particular, the gold standard, which is levodopa, which improves many of the motor symptoms of Parkinson's very well for many people. And we have medications to treat other specific symptoms. Like, as I mentioned, we have antidepressants for mood, and we have other symptom-focused treatments. We have surgical treatments. Deep brain stimulation is the one that we think about the most, and also very effective for treating specific symptoms. And then on the third part here, I have healthy lifestyle. And this is as essential as these other two pieces of management. And here, you're going to hear a lot about this today, and I'm going to be talking about exercise, but you'll also hear about nutrition and several other factors that impact healthy lifestyle. And that is really essential for managing both symptoms and quality of life, but the overall disease itself. And of all of these, the one that probably has the best effect on just general disease progression is probably healthy lifestyle, because those people who are healthier, who have less medical comorbidities, also tend to do better. So does exercise really matter, and where is the evidence? One of the shortcomings of many alternative medicine treatments is that they lack evidence, at least the kind of evidence that we look for as scientists practicing traditionally. With exercise, there's certainly not all the level of evidence that we have for some of our medication trials, but we have a really a large number of studies that have been going on over decades now, showing the impact of exercise on various aspects of life in Parkinson's disease. I'm going to start by looking at an old study here that just looked at how much do people with Parkinson's actually exercise, and how much does that affect their risk of getting Parkinson's. And this is just looking at, first of all, before people get Parkinson's disease, how much do they actually exercise? And so what you're seeing on the top, in the dotted line, the horizontal dotted line is where the average person at a particular age is exercising. And what you can see that's really interesting is that in Parkinson's disease, even up to 14 years before symptoms start or before diagnosis, people who are eventually going to get Parkinson's disease tend to be exercising less, even up to 14 years before diagnosis. And then as they become diagnosed and develop symptoms, this even gets worse. And we see that the average amount of exercise is less than that same age person without Parkinson's, and gets worse and worse over the years. And a study was done now almost 15 years ago, showing that more physical activity at baseline in men was associated with a lower risk of getting Parkinson's disease over time. So those who had the most physical activity had a 30% less risk of eventually having Parkinson's disease. Now, these sorts of studies can't tell us if it's because of the exercise that people are less likely to get Parkinson's, but there's some association between exercising more and being less likely to get Parkinson's. A study was done through our center at Northwestern using data from the Parkinson Foundation. Parkinson Foundation has a registry of thousands of people with Parkinson's disease, and we have data on those people looking at their exercise. And we looked at over 2,000 people with Parkinson's. We split them into three groups. And they self-identified as being non-exercisers, meaning 0 minutes of exercise per week, low exercisers, which was 1 to 150 minutes of exercise per week, and regular exercisers, which was greater than 150 minutes per week. And 150 minutes per week is the American Heart Association standard for how much the general population should be exercising. Well, we saw that as at 1 year, regular exercisers, those who were doing 150 minutes a week or more, had a better quality of life, better mobility, less progression of disease, less caregiver burden, and less cognitive decline. And so you can see here really a sense of the whole disease was better for those people. Physical symptoms, but just also quality of life, caregiver burden, and non-motor things like cognitive decline. So this is the theme of treating the whole person, the whole disease. What does exercise do? Why would this be helpful? I think I mentioned that I think the most important aspect here is control and empowerment. Dealing with a disease that does take some of that control away from you, not knowing what to expect down the road, a year later, what your symptoms are going to look like, and even day to day, not knowing how you're going to feel. That is, I think, what impacts people's quality of life the most. And with exercise, I feel like instead of being a passive recipient just taking medication, in addition to receiving medication, being an active participant in your healthcare makes a difference in your quality of life. In addition, there may be some science behind why exercise may work. It can facilitate control of movements by tapping into the idea of neuroplasticity. Now, this is a theory, but what neuroplasticity is that even as people get older, and even in the face of what we call a neurodegenerative disease of the brain, where areas of the brain are deteriorating, there is still some ability of the brain to remain plastic and form new connections. New connections can be developed all the time, even in elderly people, even in people with Parkinson's disease. And learning new movements can make new connections in the brain and tap into this idea of neuroplasticity. It can help make movements more automatic. And so as movements become more learned, they become easier to do. So people who are more sedentary forget how to do certain movements, or movements become less automatic. Exercise actually has been shown to promote brain growth factors. So these are chemicals that are released in our brain to help with neurons developing and growing. And exercise has been shown to release brain growth factors. Exercise also has been shown to release dopamine. Now, Parkinson's disease is a disorder of dopamine systems. So there is a deficiency of dopamine release, leading to a lot of movement problems in Parkinson's. And the mainstay of medication is levodopa, which is dopamine replacement. Exercise itself can actually release dopamine. And then exercise addresses the mind and the body simultaneously. And this gets back to that puzzle where we think of the body as the Parkinsonism, and you think of the mind as those non-motor symptoms. Exercise can address all of that together. And so we really think of exercise as complementary to medications. Medications can help treat a lot of the physical symptoms and a lot of the non-physical symptoms, and exercise can complement that by treating the whole person and the whole disease. There's some interesting small study evidence that shows the changes in the brain in response to exercise. There are studies looking at fMRI. So this is looking at the function in certain areas of the brain. And certain areas of the brain will light up when blood is flowing to them when they're active. And in this small study, 35 people with Parkinson's disease were randomly assigned to either getting aerobic exercise or a control group, which was stretching. And they did this for 3 months. And they looked at functional MRIs to see did different areas of the brain get more active or light up. And it was really interesting to see that the area most affected in Parkinson's, which is the deep part of the brain where dopamine is made and released, the group that was doing aerobic exercise had more response in those cells to dopamine and more release of dopamine in those areas than the group that was in the control setting doing stretching. And this is shown here that it lit up is the deep part of the brain that is most affected by Parkinson's, where the dopamine is produced and released. And that was more active in people who were exercising. Similarly, this is another small study, but they took 8 habitual exercisers compared to 9 sedentary people with Parkinson's. And they did PET scans, which look at, again, areas of the brain that are more or less active, how much they're using energy in different parts of the brain. And they looked at the release of dopamine, and they looked at the activation of dopamine pathways. And they showed that there was a greater dopamine release in the exercisers compared to the sedentary people, greater activation of dopamine pathways in regular exercisers. So there may be some direct effect on the brain of exercising in even the way dopamine is produced, released, and even the way the brain responds to dopamine. And the non-motor aspects. So fatigue, I would say, is the most common symptom in Parkinson's. In my experience, I would say at least 50% of people with Parkinson's experience fatigue. Exercise is a great treatment for fatigue, especially in the setting of we actually don't have good medication options to treat fatigue. And so the fact that exercise can help with fatigue is really important. Exercise can improve mood. Depression is another one of the most common symptoms we see with Parkinson's disease. Naturally, some chemicals that can lead to depression are reduced in Parkinson's disease. And exercise can actually release natural endorphins that can improve mood. And certainly antidepressants are very effective for people with Parkinson's, but this natural release of chemicals that improve mood is also important to tap into. We know that exercise improves cardiovascular health. I probably don't have to convince anyone of that. We have guidelines from heart associations, and cardiovascular health is one of the leading killers in the world. And just generally being healthier will help manage your Parkinson's disease. So my patients who have less medical comorbidities, less medical problems that require a long list of other medications, it makes it easier to treat the Parkinson's because I don't have to worry about interactions with other medications. And generally, being healthier makes it easier to treat the Parkinson's symptoms. One thing that exercise has been shown to do in animal models is improve immune function and inflammatory effects. So this is important at a cell level. We know that one of the factors in why certain cells in the brain die off or deteriorate in Parkinson's is there's signs of inflammation in some of those cells in the brain. We'd like to reduce that inflammation to try and protect those cells. And exercise can reduce inflammation. It has natural anti-inflammatory effects, and that can potentially be protective for cells in the brain. And then also importantly is the social interaction. We learned this really this year with the pandemic, is not having that social interaction, being isolated in the home, really has a negative effect on the disease. I saw this throughout the year that some of my patients were just doing worse because they weren't engaging with people as much. And I'm looking forward to now that that is improving, that people are going to start socializing more, and I think quality of life will improve. And exercise is one of the big ways that our patients will interact socially in group exercise activities. There's a tendency, I feel, in Parkinson's for people to become more introverted. And this idea that social activities like exercise groups can get you out of that is very important for quality of life. So knowing all this, and we educate our patients about exercise all the time. And I think around the country and around the world, this is happening. I don't think exercise is considered alternative. I think it's considered conventional standard of care at this point. And yet people with Parkinson's are still not exercising enough. And so we looked at a survey, we did a survey of what are the barriers, what are the motivators, and what are the barriers in Parkinson's to exercise. Prior studies had already shown that some people are not exercising enough because they just don't have the time or the access to exercise programs. Some people are afraid of falling, and that's the reason why they don't exercise. In our survey, where we took over 100 non-exercisers with Parkinson's and compared them to over 100 exercisers with Parkinson's, we found that the difference was that the ones who are not exercising had more fatigue, more depression, and they lacked motivation. They needed someone to motivate them to exercise. And that's what separated out the exercisers from the non-exercisers. This is really important because I already mentioned fatigue and depression are particularly two symptoms that exercise can help with. And so the fact that people are not doing it because of fatigue and depression is counterproductive when exercise is actually something that can help those problems. And then lastly, lack of motivation, which is why we're here to educate, to make sure that people understand the importance. Non-motor symptoms are important. I mean, I mentioned fatigue and depression, but when we look at large studies over 20 years following people with Parkinson's disease, the most disabling long-term problems of Parkinson's disease relate to the symptoms that are not improved by levodopa. So it's not the tremor or the slowness that has the biggest impact on quality of life long-term. It's the depression and it's the cognitive deficits that don't respond as well to the carbidopa, levodopa that tend to impact quality of life. And these are common. So if you look at the non-motor symptoms, mood disorders, I've put percentages here of general frequencies, although depending on the study you look at, these numbers vary widely. But in general, you can see almost a third of people with any one of these particular non-motor issues in the big categories being mood disorders, blood pressure fluctuations, cognitive issues, fatigue, constipation, sexual dysfunction, sleep disturbances, and urinary dysfunction. And the impact that exercise can have on these should not be discounted. I know this is a slide that's hard to see, but the importance isn't to see all the details on this chart. What this is a summary of 6 different trials that were done to look at the impact of exercise specifically on depression. So they did, one of them is a strength building exercise. Another trial looked at aerobic exercise. One looked at treadmill. One looked at resistance exercise. And across the board, 5 out of these 6 studies showed improvement in depression scores directly because of exercise compared to a group that was not doing exercise. Similarly, we can look at sleep. Sleep is one of the most common problems that we deal with also in our day-to-day practice in clinic. Lots of various reasons why people with Parkinson's may have impacted sleep. This was looking at the effect of comparing sleep hygiene, which is just education about good sleep practices, compared to exercise and its effect on sleep. And exercise, as you can see from various measures of sleep, was more effective than just education about sleep in terms of helping with sleep. So those who exercised had better sleep efficiency, they had deeper sleep, they had better total sleep time compared to those who were just educated about good practices related to sleep. And then cognition. We don't have great medications to treat cognitive impairment in Parkinson's or in any condition really. In this study, so this is summarized in my highlighted section here, they found that, first of all, cognitive activity like mental games, creative things like art and music in midlife was associated with less risk of getting dementia later on. And then again, also physical activity, which is what we're here to talk about now, physical activity in midlife was associated with a reduced risk of developing dementia. And so this HR 0.43, which is called a hazard ratio, this tells us that people in midlife who are more active have about a 40% less risk of developing dementia over time. So that's pretty powerful. So the next logical question is, what kind of exercise should you be doing? And I have here lots of different forms of more traditional and less traditional exercise and various kinds of mind-body activities as well. So dance has actually been studied in several small studies in Parkinson's. There are studies looking at tango, waltz, foxtrot. In this particular study of tango of 19 patients, it showed improved balance, overall motor Parkinson's scores improved. Tango requires balance and also attention and coordination with a partner and interaction with a partner. And other forms of dance and music too can improve mood and quality of life and general motor function. Boxing. A lot of people have heard about boxing in the context of rock steady boxing, which is available in many places around the country. Boxing is forced intense exercise, brief bursts of movement that can also improve balance and coordination and speed and agility and strength. So lots of various benefits here that could be relevant to Parkinson's. In this small study of 31 people with Parkinson's who were randomly assigned to get boxing intervention versus conventional exercise, the boxing group actually did better than the conventional exercise group when it came to speed of movement and endurance. And both groups, the conventional and the boxing group, improved on balance, mobility, and quality of life. So we want to do a bigger survey. This is not yet published, soon to be published. We looked at over 2,000 people with Parkinson's and we did a survey. And the majority of people who were participating in rock steady boxing said that it improved their social life, fatigue, fear of falling, depression, anxiety. So remember I mentioned one of the barriers to exercise is people are afraid of falling. Well, you can see that in this case, people who were doing rock steady boxing actually reported an improvement in fear of falling. And then compared to people who never participated, those who participated in boxing had better general quality of life scores and self-efficacy scores. 99% of them said that they would recommend it to other people. And if you look at on the graph on the right, you can see the different symptoms that people reported improvement in. And remembering that this is a survey, and so this isn't objective, but people are describing benefits for various symptoms, which include both motor and non-motor issues, everything from tremor to dyskinesias to anxiety and fatigue. Intensity of exercise may also be important. So there was a study that was done, the investigator Daniel Korkos is actually at Northwestern. He looked at 128 people and compared the intensity of their exercise on a treadmill. Intensity being defined in that study by how high your heart rate goes. And high intensity was 80 to 85% maximal heart rate. And he saw that there was the lowest decline in motor scores in the group that did the highest intensity. In other words, the physical symptoms that we measure in our visits with patients had less of a decline in those that did a higher intensity exercise. So he's actually continuing this now with an active study, which is going on now. It's a phase 3 study where he's randomizing people to 80 to 85% maximal heart rate versus 60 to 65% maximal heart rate. So like moderate intensity versus high intensity exercise to see if one is more effective than the other in slowing down progression of symptoms. There are also advantages to less traditional forms of physical activity, which I would consider mind-body interventions. And again, these are interventions that tap into a more holistic approach to taking care of yourself. Tai Chi is one example. Tai Chi got a lot of attention because they actually had a nice study published in the New England Journal of Medicine, which is one of the highest level journals in terms of level of evidence. This is a Chinese martial art that involves also meditation, and therefore I describe it as a mind-body intervention. It focuses on different balance techniques that you hold in choreographed movements and breathing and maintaining certain postures. And it was shown to improve balance and motor control in people with Parkinson's disease, a study of nearly 200 people. And I think these results from that study are pretty impressive. If you just look at falls, they looked at the total falls that people had. And what you're seeing here is that in the group that did Tai Chi, compared to the group that did resistance or stretching exercises. Oh, sorry, I'm getting a message here. Okay, hopefully you can still see me. What you can see here is that in the group that did Tai Chi, as a total, the number of falls that those 65 people had over the period of time that they were studied was 62 falls. But in the resistance and the stretching groups, it was 133 and 186 falls. So it's a big difference in the number of falls that the group in Tai Chi had, which further strengthened the evidence behind this intervention for people with Parkinson's. We did a small study of yoga as an intervention to improve balance, but also mood and anxiety. And we compared yoga in a small group of people to conventional resistance exercise. And we found that both groups improved in their motor scores, but the group that improved more on anxiety scores was the yoga group. So that again taps into this idea of the mind-body connection. So some suggestions, some practical things for you to think about. And in thinking about what kind of exercise to do, first of all, I always tell my patients, I don't really think that we have great evidence that there is one right kind of exercise. I think it should be individualized. I think for everybody, it might be a different form of exercise, but there are some things to look for as a theme. One is a goal-based practice where you're acquiring a new skill. This taps into the idea of neuroplasticity again. If you're learning something new, you're learning how to do something differently, your brain is learning to make new connections. That can be helpful from a motor standpoint and even a cognitive standpoint. It should be something where you're learning through reinforcement by an instructor that can teach you how to do it the right way, in a supervised way. And it should be enjoyable and ideally social. And that last piece, the social piece, was something we had to forego over the last year. But hopefully we'll start to be able to incorporate that more again. But if it's not enjoyable, probably not going to stick with it. So if someone tells you need to be swimming for Parkinson's or you need to be cycling for Parkinson's, but you don't enjoy that, then maybe that's not what you should be doing. Maybe you need to find boxing or something else that you enjoy. And then again, something social so that it kind of gets you into that group environment, talking to other people. That can be good from an emotional standpoint. Ideally, you should be doing this with well-trained instructors who understand Parkinson's disease. There are going to be unique things about Parkinson's that are different from exercise programs that are not designed for Parkinson's. For instance, does your instructor understand what freezing is? That maybe when you're exercising, you might be prone to getting stuck in your place. Do they understand that your blood pressure may be sensitive when you stand up and sit down? And so there are various aspects here where having a trained instructor who knows Parkinson's can be an advantage. And then finding a class that's appropriate to your level. And that means not going, if you're having problems with balance and you're older, not going to the local gym and participating in the very aggressive class that's designed for the 20-year-olds who are really active, but finding a class that's suited to you. If you're in a wheelchair, that's not a reason not to exercise. It's a reason to find a class that, an exercise class or a type of exercise that you can do in a wheelchair, because it still makes a big difference. You can do pedaling, you can do stretching. There are still things that you can do. And so this is the exercise prescription that I'm going to leave you with. This is not based on a specific study. These are my own personal guidelines that kind of comes as a summary from what I've talked about. So first is keep active. Find a physical activity that you enjoy. That will keep you active. The second is do some aerobic activity. There is good evidence that getting your heart rate up is effective. How high? Again, that's still being studied, but we know at least that the Heart Association guidelines for the general public tells us to exercise 150 minutes a week. I say 30 minutes of moderate intensity, getting your heart rate up where you're a little short of breath. A good test of that is, instead of just having to check your heart rate, if you're a little short of breath where you couldn't have easy, fluent conversation with someone, if you were be a little short of breath singing a song, that's probably at moderate intensity. And if you can do that for 30 minutes, 5 days a week, brisk walking, cycling, boxing, swimming, it can be any number of things. And then strength building. There's some good evidence that using resistance to build strength can be helpful in Parkinson's. So I said here, using weights or resistance bands for 30 minutes twice a week. You may need a trainer or a therapist to show you the proper techniques if you don't know them, whether it's squats or lunges or rowing. You want to know that you're doing it correctly and not hurting yourself. And then lastly, balance training. We know falls become a greater risk over time with Parkinson's. So considering mind-body interventions that can help with balance, but that can also tap into the non-motor things like anxiety and mood, considering things like Tai Chi, yoga, dance therapy, 30 minutes, 2 times a week. Interventions with mind-body benefits are preferable in this context. These are usually the less intensive, but still helpful from a mood and emotional standpoint. And so with that, I'll leave you with just a few key points. Motor and non-motor issues in Parkinson's have an impact on quality of life. Exercise and healthy lifestyle can address the full spectrum of Parkinson's related issues. And now, this is not as an alternative to medication. This is complementary. This is helpful to your medications. And in fact, for some people, having the right medications will allow you to exercise at a top level, which you may not be able to do without medication. And so the two together, the people who go to the regular doctor's visits, get the appropriate medications, but also are empowered to exercise, are the ones who I think do the best. Exercise can improve quality of life. It can slow down decline in physical function, and it's an essential part of the treatment of Parkinson's disease. Thank you for your attention, and I'll be happy to take questions at the question and answer panel at the end.